Now on the American Health Journal. Pain can be debilitating to someone on a daily basis, but there's new technology in the treatment of pain. We spoke with Dr. Peter Abaci, co-founder of the Bay Area Pain and Wellness Center in Los Gatos, California, and author of Take Charge of Your Chronic Pain.
When we evaluate a patient at the Bay Area Pain and Wellness Center, what we want to do is to be able to get a picture, like a painting of this person, and to really be able to understand how that person's functioning, how they feel, everything about them. And that allows us to come up with the best plan that we can to help that person get better and feel better. The old way of doing things is looking at the pain generator. And what a pain generator is looking at what is the source of the pain, what's the anatomic part of the body that has caused the pain to start. And that's useful when we first get injured, because there usually is something that starts the whole cascade of pain and chronic pain down the road. But if we just focus on that, and 5 years later, 10 years later, we're still struggling with our chronic pain, and we stay focused on the pain generator as opposed to the whole totality of the problem, then we're missing the boat. We're always coming up with new things, new toys, new gadgets, new breakthroughs, and you know it's coming. But what's critical is to know how to take all that information, how to take all that technology and make it work for you. And I think the perspective you want to take is, how is this going to help me be healthy and feel better, not just today, but for the next 5 years, the next 10 years, the next 20 years. We've come to realize that a lot of the medications we use have a lot of side effects and can cause sometimes more harm than good. And interestingly, there are a lot of good nutritional alternatives to the medications that we use that can reduce inflammation, lower the effects that pain can have on our bodies, and can actually help us get some of the same types of relief that we're looking for from prescription medications, and perhaps do it in a way where we don't have the same side effects and our health is better managed. I've had a lot of older patients come in over the years and tell me, "Doc, this ain't living." And I think what happens is, we want to manage our health the same way we do our retirement. We start putting and saving money and investing in retirement when we're young, so that when we're older and we're ready to retire, we have enough to take care of ourselves so that we're happy. And I think we have to do the same thing with our health. And what we're finding is, if we don't do that, if we don't learn how to take good care of our muscles, our joints, our bodies, our brains, then we're going to be in pain when we get older. And it's too late to change it when that happens.
Have medications taken over in the treatment of pain and pain management?
It has taken over the way doctors practice, and they become symptom managers as opposed to healers. And we want to bring that back into what we're doing to help people get into the root problems of why they're having the pain. What are the problems behind it? What are all the issues surrounding their struggles and their suffering? And let's get to the bottom of it, and let's get to the heart of the matter, and let's come up with a plan to work through that. And sure, medications might be a part of that for some, and maybe not for others, but let's expand our search of how we're going to solve these problems.
We asked Dr. Abaci what it'll be like in 5 years in regard to treating pain.
In 5 years, what I see changing is the insurance world, and the U.S. government is desperately trying to find ways to make healthcare more affordable as well as better. And I think that's going to impact the way that chronic pain gets treated. And I think what you're going to see is less surgeries, less procedures, and less expensive medications being used, and more of an emphasis on looking at other ways of helping people solve the pain problems that they're dealing with. And I think you're going to see a big shift away from expensive medications and an over-utilization of injections, and gravitating more towards all the other ways that people can more successfully manage their pain.